changed up, ready to go to radiation. So this is the radiation room. It looks kind of like a CAT scan, but it moves around the table. So I'm gonna lay here and put my arms up over my head and hold onto these handles. They're gonna position me so that all of the markings on my body line up with the beam, and then they leave the room and I follow the directions to hold my breath, usually about 5 times, and it takes about 15 minutes. And I'm all done now, and now I'm just going to put my lotion all over the area, and then I'm heading home. All right, I wanted to just show you the information that they did give me at the start of radiation, just informing me about potential side effects and skin care of the treatment area. It does tell you in this to only use the creams that they recommend, but I'm going to talk about that in a second separately, because I'm going to kind of go through what I am using as far as products. And then this sheet talks about the breath hold and why I hold my breath during the treatment. And so if you look at this picture, normal breathing, a little bit of the heart might actually make it into the radiated area. And so when I hold my breath, it moves the heart out of the way. The lungs expand and push the heart out of the way. And so there is much less chance of affecting the heart. And so that's why we hold our breath. It says 20 to 40 seconds. I've counted probably mostly 15 to 20 seconds for those treatments. And again, there's only like 5 of them. And there is another little picture here about, there's the heart in the treatment area. When I hold my breath, it moves the heart out of the way. So sorry about that. I hit the button. So these are the instructions. It does talk about holding your breath for, probably 20 seconds or so. And if I were to let my breath out, if I couldn't hold it, it would automatically shut off the beam. So if the heart moved back into the treatment area, the machine automatically shuts it off. So I think that's all, lots of good safety features that I think are helpful. Hi everyone. Okay, so I want to go through the skincare for radiation. And so let's start with what they gave me. At my first visit, they gave me the paperwork I just showed you, and they gave me 2 products that I could use on my skin as we went through radiation that they have free samples of. And so the 2 that they gave me were this Eucerin Original Healing Cream and Aquaphor Advanced Therapy Ointment. And I have been, since my diagnosis and since the genetic counseling where we discovered that my cancer is not genetic in origin, it was from a spontaneous mutation, probably from some environmental factor. I've been really trying to minimize the chemicals that I'm using on my body or in my body. And so I've been using the Yucca app, which is Y-U-K-A. If I can figure out how to edit the video right, I'll stick a screenshot in there. And basically, when I'm buying shampoo or soap or lotions or anything like that, I scan it with the Yucca app. So the first thing I did when I got these 2 products was scan it with the Yucca app. And what I found was that both of them have scored really, really low. They have some harmful ingredients in them, or potentially harmful ingredients. Now, my take on this is, if I need it temporarily because nothing else is working, just to get through the radiation, then, and this is the best product, the only thing that works to kind of keep the burns at a minimum, then okay, I would consider it. I have not yet needed to open either one of these. They're both still sealed. So the ingredients that Yucca says are in both of these products are petrolatum, which is a petroleum derivative, and there are scientific citations in the Yucca app. So if you scan a product and it tells you that there's some questionable ingredients, it will list the scientific papers that talk about that particular risk of that particular product. So this app is amazing for that. So may damage DNA, It accumulates in the lymph nodes in the liver, and it has an inflammatory response for many people. Petrolatum, paraffinum liquid, and ceresin, I think that's how it's pronounced, ceresin, are in both of those products. And then also, I think the Eucerin also has phenoxyethanol. Okay, so it's an alcohol, and that is regulated heavily in the European Union, but not so much here in the United States for some reason. It is an endocrine disruptor, and it also can cause potential harm to aquatic species. So if I were to put this on my body and swim in a lake or an ocean, it could be harmful to aquatic species. So there's some reasons that I would not choose this product first. So that led me to the store to search for different products. Also, a friend of mine who is also a breast cancer survivor had sent me this oncology recovery cream. And I have used this a few times just because it was open. I opened it already. And it does have, let's see, what does it have in here? It doesn't have the petrolatum, but it does have the phenoxyethanol in it. So it's something I have used just because I had this, it was given to me. I wasn't going to throw it away. I tried it and just kind of, put it on my skin. I didn't really see that it made too much of a difference. So I haven't been using that either. I think I used it once or twice. Then another friend who's a nurse sent me some diaper cream. I have not opened this yet. It's still sealed. But I've heard that diaper cream can help with radiation burns. So this is just zinc oxide, and it doesn't have any, it does have petrolatum in it as well. And I think that's the only questionable ingredient in this. So I haven't opened it because of that really, or tried it, but it's there. I have things available. Next I had, they say you can treat it like a sunburn. And so I did have some Banana Boat After Sun aloe lotion, which this has some phenoxyethanol in it, which is something that concerns me because we always use this when we're on vacation and swimming with aquatic wildlife. So that's something that we'll be looking for alternatives for soon anyway. Next, as I started to get some itchiness under the scar, on the surgical scar, which is in the treatment area for radiation, they did prescribe some steroid cream, mometasone, and I had a problem with this. And so the problem is that when I opened it and applied it, there were some little beads in the cream that were abrasive, and that's not supposed to be the case. It's a steroid cream. It's supposed to be calming for irritated skin. And so I brought it back to the pharmacy. The pharmacist says that's the way it comes. Here's the phone number to the pharmaceutical company. I called the pharmaceutical company. They did not say whether or not it was supposed to be like that, but they sent me a new tube. It's the same thing. There is some wax as an ingredient in here. And so I think that maybe it's the wax, because when you rub it in, if you keep rubbing it, it does eventually dissolve into the skin, except for the fact that it's initially scratchy. And so they don't want me using it. So I've tried it. I've opened it. Discovered that issue, and I haven't used it since. So basically, that's what the doctors prescribe for radiation patients, and especially, itchiness on a surgical scar that's being irradiated and getting basically a sunburn on it. He doesn't want me using it now. And, that's some, he said I could just use over-the-counter hydrocortisone cream, which I do have some of. I haven't even tried that though. I have some other products that I've been using instead. So let's get into those. The next little thing that they gave me, just to kind of be soothing on the whole area, was a big bottle of saline and some gauze. and instructions to do some saline soaks. And so it just talks about using a piece of gauze, soaking the gauze into in the saline solution, and just like kind of applying that on the area and letting it sit for 10 or 20 minutes. And saline can be very soothing and cleansing, and that's one thing that they suggested I could do if it's really getting irritated. I have not done it yet because I've been doing pretty well. And the second thing that they gave me last week was this something called Span Gel Primary Hydrogel Sheet. I think this is for like literally for like burn patients. And so it's got this hydrogel in it. I didn't look at the ingredients of this. It doesn't say what the ingredients are, or whatever hydrogel is. And so they told me that I can put this in the refrigerator for about 10 minutes and then put this, again, apply it to the area and let it kind of, it's wet when you apply it, and just kind of let it sit for a half hour or so. And it should be soothing, as if it, just like it would be soothing to a burn patient. So I have these as well. I haven't needed them yet. Okay, so what did I do? I went to the drugstore and I started scanning moisturizers, and like, you know, you think I went to the regular section, kind of where the Eucerin was, and I scanned a few products and everything had the same ingredients in it. And then I went to the baby section thinking, you know, baby skin is really good, and Johnson & Johnson's and Aveeno and stuff. And now I do have a soy allergy. I have had irritation on my skin when I've used a product that had soy in it, so I avoid those. So there may have been some products that scanned in the Yucca app that they were good, but if they have soy in it, I avoid them. So like Aveeno, I think the Aveeno baby or something was like that. So what did I find? I did find a baby lotion that, oh, and they told me I could use things like coconut oil, aloe, pure aloe, and castor oil, which castor oil, I do find that it is extremely helpful for things like the hidradenitis suppurativa. If I have an outbreak of that, I have discovered that if I put some castor oil on it, it drains overnight and it doesn't hurt the next day. And in a couple of days, it's gone. And so that's a game changer for the hidradenitis. That was the recommendation of my naturopath. Thank you very much. So that's helpful. The oncologist, the radio oncologist, did suggest that I could potentially try using the castor oil if I find it soothing on the radiation area. I did put it on that night, which was just a couple days ago. I don't really know that it's soothing in that regard. What the castor oil does is it kind of draws impurities out, and I don't think that area needs to drain. It just needs to be soothed. So calendula is another natural, calendula cream is a natural homeopathic that is soothing to the skin. And so I've been using this actually from day one of radiation. And it's good for minor burns, cuts, scrapes, sunburn, chafing. And I've been using it for, I don't know, a couple of years anyway, for things like that. And so there's really nothing else to this. Inactive ingredients. There's some alcohol in it, which my dermatologist suggested, minimizing in the burn area. But other than that, it is kind of more of an ointment. So it's not, and there's no other harmful ingredients in this. It's all glycerin, sodium hydroxide, sorbic acid. So nothing toxic in calendula. Let me decline that phone call. And so calendula, coconut oil, aloe, and then this product, Hello Bello Baby Lotion, has in it aloe, jojoba, calendula, avocado, and cucumber extracts. This in the Yucca app scores 100 out of 100. It is all safe ingredients, and I find it extremely soothing. The only thing that this has that I would normally have tried to avoid is fragrance, but it's extremely light fragrance. that comes from a lavender essential oil. And so it's not harsh at all. And so I've been using this several times a day, every single day. When I come out of, I have one in my purse. And so when I come out of radiation, I basically just lather up. Like I put it all over from here all the way down to under the breast and under the arm, that entire area that gets radiation. And it's very soothing and cooling. And this is my go-to. Other products that I've used, I have 4 more products to talk about that I find soothing for when it's a little bit more itchy or a little bit more painful, or when I go to bed at night or right when I get out of the shower. And so there are 4 products here. They're all by Ro Casa Organics, and I'll link to their website in the description. The first one is their After Sun Cooling Spray. And so this is kind of what I've been replacing this with. So this is what we've used for years and years when we get a sunburn, something like this, or the gel, same ingredients in the gel though. It's not just pure aloe. So you can use something like pure aloe or this After Sun spray, which has distilled water, prickly pear seed oil, French seaweed, colloidal silver, methyl oil, and then therapeutic grade essential oils of peppermint, lavender, camphor, and eucalyptus. And it is extremely soothing on sunburned skin. And so I've used this after my shower. I spray a little bit on my hand and I just kind of pat the whole area. So I get this kind of benefit of that. The next thing I have from them is their Skin Soothe Body Cream. And I've been using this at night. So at bedtime, all through the day, I use the Hello Bello because it's convenient and it's easy to bring with me. This is in a glass jar that I don't want to break in my purse. So it smells delicious. It's just, it's in a base of coconut oil, I think. Yes, organic, raw, unrefined, cold pressed coconut oil, raw shea butter, and 100% pure therapeutic grade essential oils of frankincense, lavender, cedarwood, geranium, and patchouli. It's a relaxing smell that actually helps me sleep, and it is very soothing to the skin. So when it's itchy or just a little painful, because it's like having a sunburn, like you can see that it's just like having a sunburn. And so just kind of rubbing this so that it turns basically into an oil in my hands, and kind of I pat it as opposed to rubbing it on the skin. And it's very soothing. So Skin Soothe Body Cream. Next, again, underneath the breast where the surgical scar is, that is the part of my body that I have the most challenge with. And so it gets really itchy. That was what this mometasone was supposed to be for, but I find the mometasone abrasive. He said I could use just over-the-counter hydrocortisone cream, but even that is only, I don't know. I've been trying to find natural alternatives as much as I can, and the Ro Casa Stop the Itch is fabulous. So organic, raw, and unrefined coconut oil, raw shea butter, bentonite clay, organic apple cider vinegar, colloidal silver, and therapeutic grade essential oils of peppermint and lavender. Also smells absolutely divine. It's very, very mild smell. It's not a strong aroma of essential oils, but if I put this on, the itch goes away almost immediately. And that is better than hydrocortisone, in my opinion. And then I haven't used this yet, but I also have their Boo Boo Salve. And so I have one spot right where the bottom of the surgical scar comes to a T. And so there's a scar across the bottom and a scar that comes up the middle. And right at that junction, it's like extra irritated, and I'm watching it very closely because it looks a little whitish, almost like it could be, it's not infected, but I'm watching it to make sure it doesn't get infected. And so the Boo Boo Salve, I think, is something I kind of have in my back pocket. Again, it doesn't really smell. I haven't needed to use it yet, but this has some of the same ingredients: raw shea butter, organic and unrefined coconut oil, beeswax, calendula, colloidal silver, and therapeutic grade lavender, cedarwood, and frankincense. And it is, again, I'm kind of keeping it in case I do get any, if it starts to ooze or anything, then I'll be using the Boo Boo salve as well. But so far I haven't needed it. I think that the Skin Soothe, the Stop the Itch, and the Hello Bello, these are my 3 favorites that I use nearly every day. So that's pretty much the skincare. Yeah, let me know in the comments if you're going through radiation and you have other suggestions. Please let me know. Again, I try and scan everything with the Yucca app because I'm trying to avoid any potentially harmful ingredients as much as I can. I know that we can't avoid all of the chemicals in our environment, but we can do what we can. So oops, sorry, my battery's running dead. For washing the area, this Hello Bello actually has a baby wash, and that's what I've been using in the shower. I have a goat milk, a locally made goat's milk soap as well, but there are some, that's a little bit more drying. And so the baby lotion is a little bit more moisturizing. Baby lotion, the baby wash is a little more moisturizing. So I've been using that for now mostly, but I do have the goat's milk soap is nice. It's soothing, but it's drying. And so, yeah, that's pretty much it. All right. Again, let me know if you have any other, if you have any questions about radiation, or if you have any other comments about things that have helped you. That's a long video. Have a great day.